next we have a presentation on the impact of COVID-19 on dementia patients. Now more than ever, we need to figure out how to maneuver this pandemic and how to continue doing what we do best while we're still trying to understand everything that's going on around us. We have Dr. Art Walaszek. And if I am not saying your name right, please just unmute your microphone and then say, Binta, that's not the way to say it. This is how we say it, and I would appreciate that. Dr. Art Walaszek is a board certified geriatric psychiatrist. I'm going to be twisting my tongue today. And professor of psychiatry at the University of Wisconsin School of Medicine and Public Health. Dr. Walaszek is a vice chair for education and faculty development and director of psychiatry residency training. He's a past president of the American Association of Directors of Psychiatry Residency Training. His research focuses on public health approaches to improving the care of people with dementia. Dr. Walaszek works with the Wisconsin Alzheimer's Disease Research Center, where he is co-leader of the Outreach, Recruitment, and Education Core, and with the Wisconsin Alzheimer's Institute, where he leads the public health pillar. We'll wait on that. Dr. Walaszek provides care to older adults with depression, anxiety, dementia, and other mental health conditions, and teaches others to do the same. We're honored to be in your presence today. Thank you very much for joining us. Over to you.
Thank you very much. Can folks hear me okay? Great. Excellent. Well, welcome. Binta, you got my name exactly right. So thank you very much. You nailed it. Well done. Great emceeing. Fatu, Binta, members of the planning committee, thanks very much for inviting me. It's really an honor to be here at this great event. Somehow I'm going to follow First Lady Evers and the unbelievable Gina Green Harris. So I'm not sure how well that's going to go, but I'll give it my best shot. I'm also going to be followed by Barb Bendlin, who's outstanding and is going to be talking about healthy brain aging as well. So I'll try to meet that standard. And it's cool to see in the audience, we have an international audience. So that's really great. So congratulations again to the organizers for planning this international event. I look forward to sharing with you what we know so far about the impact of COVID-19 on dementia. So let me go ahead and share. Okay. Can folks see that okay?
Yes.
Awesome. Okay, very good. So let me just dive right in. So it's really kind of, just amazing the impact that this tiny virus has had on our society. We're completely transformed over the last few months. We've lost 250,000 Americans as a result of this virus, plus, millions of people worldwide. If you sort of stretch out your arm, you could fit 1 billion of these viruses end to end across your arm. So this tiny little guy is wreaking such incredible havoc. And it especially takes a toll, as we know, on older adults who have the highest fatality rates from COVID and have the most medical complications from COVID. And it also takes a special hit on people with dementia. One of the themes for today is, COVID obviously affects many organs, most prominently the lungs. You get a pneumonia from COVID, but it's very much a brain disease as well. And so that's important both as we think about an aging population and preserving brain health. And it's important because dementia is a brain illness as well. And so not surprisingly, there's an overlap between dementia and impact of COVID. And also, obviously, this is a disease that's taken a huge human toll, both on people with COVID and on their caregivers, on their family members. And there are all the pandemic related restrictions and isolation and quarantine and so on that have also had a significant impact. So I'll try to kind of summarize that over the course of the presentation. I should say too, we're very early on our journey of understanding the relationship between COVID and dementia. So as of last night at 8 p.m., there were 76,103 medical articles indexed in something called PubMed. PubMed is where probably at this point, 1 billion articles about medicine are tracked. So 76,000 articles on COVID. And of those, less than 0.5% have to do with dementia and the impact of COVID on dementia, which in some ways is not surprising. You know, the biggest impacts initially are on ability to breathe and survive and so on. So it makes sense that that would be the initial focus. But in the long run, we're going to see a very significant brain effect from COVID, and I'll review with you in a moment kind of what we know about the cognitive toll that COVID has taken on people. So I would anticipate that this tiny slice of the pie that we see right now is going to get, unfortunately, much, much bigger over time as we learn more about the negative effects of COVID on people with dementia, on their caregivers, and on our healthcare system as well. So just a quick run through of what we'll cover today. We'll just start with some basics. I know this is a sophisticated crowd, but just to make sure we are all on the same page about what is dementia. I'm going to be talking about delirium as well, because that's a really important point in terms of how COVID shows up in older adults, which I'll get to in a moment. We'll talk then about kind of, you know, the heart of the matter is what is the impact of COVID itself on people with dementia, and also the pandemic related restrictions on people with dementia. We'll talk about the impact on caregivers and on services available to caregivers. So I'll present to you some work that we at Wisconsin Alzheimer's Institute did this fall, collecting information about what's happened to services for people with dementia in the midst of the pandemic. We'll talk some about elder abuse and fraud as well. So we don't have a lot of information about that yet, but I'll share with you what we do know. And then I'd be remiss if, as a physician and as a public health researcher, I didn't sort of share with you the latest kind of advice around staying safe, both for people with dementia, their caregivers, and you and your family members and your loved ones. Okay, so just, you know, very basic stuff, and I apologize if, you know, this is review for folks, but just to make sure we're starting off at the same page. Dementia, which is also known as major neurocognitive disorder, is a syndrome that usually arises in late life. So it's acquired, it comes later on. It's persistent, doesn't go away, unfortunately, and it almost always results in a decline over time. And there are specific aspects of thinking that are affected. Memory is the big one, but also language, also how we process visual information, how we problem solve. And actually, this will come up later because one of the impacts long-term that we're seeing with COVID on people is it affects something called executive function. Executive function is we have executive function because of these beautiful frontal lobes in the front of our brains. They're gigantic, and they allow us to do things like plan and strategize and do things in the right sequence and impulse control and various other things that are really necessary to function well on a day-to-day basis. And unfortunately, one of the impacts we're seeing with COVID is that it's taking a toll on people's executive function. Other areas that could be affected are attention, and then recognizing things like objects and faces and so on. And all that then leads to problems in day-to-day living, whether it's driving or money management or cooking or managing your pills or whatever. You need those two things to have the diagnosis of dementia: some sort of change in cognition, and then some associated change in functioning. And usually this is a gradual, over months to years kind of progression. Now that's different from delirium. So delirium is an acute change in mental status. So anybody can get delirious at any point. If I had a severe enough infection, for example, like a meningitis, I could get delirious. If I had a seizure right now, I could be delirious after that. If I stopped drinking for the next 3 days and my electrolytes got out of whack, I would be delirious as a result of that. So any one of us can get delirious. It is a brain state that includes acute changes, so over hours to days, and usually affects things like orientation, like where am I, what day is it, attention. So someone with delirium has a hard time paying attention to things, can be very easily distracted. And arousal. Arousal means being awake. So my current arousal method is to be drinking a bunch of coffee. It is morning, so that helps. Usually there's some natural arousal as well. People with delirium, their arousal gets messed up. They may be up all night and asleep all day, or they may be sort of in and out of alertness and consciousness. So that's delirium, and it looks a lot different from dementia because it comes on quickly and it has these really marked changes. Uh, Now, the two overlap. If you have dementia, you are more likely to get delirious. So if your brain is not in a sort of optimal healthy state, it's easier to get delirious. So the two are related to each other. And sometimes we don't know someone has dementia until they show up with their first episode of delirium. And then we look back like, oh, actually, they have been declining over time. They probably have a dementia underneath this delirium. Again, this is going to be important because the classic presentation of COVID is shortness of breath, fatigue, fever, etc. Very few older adults actually have that classic presentation of COVID. Delirium is a very common presentation of COVID. So recognizing delirium in an older adult is important because one of the things in the last 6 months, at least, that we've been thinking about is, well, could this be COVID causing the delirium, which is a new thing to add to our list of possible causes of delirium. I'm also going to be talking today about the effect of COVID on the behavior of people with dementia. So this is an area that's very near and dear to my heart. It's called Behavioral and Psychological Symptoms of Dementia. And it sort of accounts or addresses the fact that though dementia is defined as changes in cognition plus functioning, the reality also is that 90% of people with dementia will have some change of behavior or emotion over the course of their dementia. So about half, 49%, have apathy, which is a lack of interest in activities. 42% have depression. 40% have aggression. 39% have a sleep disorder, and so on. So I won't recite all these. These are all in front of you, but these are really, really common, and can really be quite distressing to the person with dementia and to their loved ones, and potentially dangerous, as in the case of aggression, for example. So these are really common, and one of the things that we're seeing with COVID is that there's more behavioral and psychological symptoms of dementia, either due to COVID itself or the isolation and change in routine that's gone along with all the restrictions that we've understandably had to do with the pandemic. Okay, so let me shift gears over into COVID now, and there's growing recognition that in people of all ages, COVID takes a toll on their thinking. And so this is a New York Times article, for example, from last month, describing a brain fog that many people, it takes months for them to shake off this brain fog, or even longer. And so this is, evidence that COVID itself is having an impact on the brain. Even in younger, healthy people, it can take a toll on the brain. It's not resulting in dementia yet, as far as we can tell, although that would be one of the concerns, that this cognitive decline that people get from COVID, what if it's not completely reversible, and then those folks are at higher risk of dementia later down the line. So again, unfortunately, I think we're going to see a lot of downstream consequences of COVID from a brain health perspective. So this has certainly it's been in the news. There's a lot of public awareness now about the cognitive impact broadly of COVID. Now, before we get any further, I do just want to do some more defining of terms, again, to make sure we're all on the same page. And this is fairly new to me. I did not know any of these terms except, the ones in the middle bullet point prior to March. So the name of the virus that causes the disease we're talking about is SARS-CoV-2. And you got the full name down in the footnote below. So that is the actual virus itself. It is a coronavirus. So when we're talking about coronavirus, we're talking about a family of viruses, a collection of them, just like, Cocker Spaniel versus dog. So dog is the broader category, Cocker Spaniel is the specific. Similarly, SARS-CoV-2 is the specific virus within the coronavirus family that we're talking about. Older coronaviruses cause the common cold. So many of us probably have had a different coronavirus infection over the years that's much more mild. It's just a common cold. It has also caused two other very serious illnesses. I misspelled that. It's not SIRS, it's SARS, S-A-R-S. So that was a very serious illness in China and in Canada and multiple other countries in 2003. And then MERS, the M-E is Middle East respiratory syndrome. So that was a pandemic that was mostly in Saudi Arabia, but also hit a few other countries as well in 2012. So those are also coronaviruses. This particular coronavirus is, as you've seen, far, far worse than all of those. And the illness it causes is COVID-19. So coronavirus infectious disease 2019 for when it was thought to first have arisen in December 2019 and described in Wuhan, China. So that's the terminology with respect to COVID. And I should say, I'm not an infectious disease doctor. I'm not an epidemiologist. So this is just from my understanding as a physician and looking at the CDC website and so on. Okay, so again, I want to highlight COVID is a brain disorder. So it's been well described. These are studies of people of all ages, so not necessarily just older adults or people with dementia. But in the first few days, delirium is not uncommon. Memory loss is not uncommon. Psychosis, so that means hallucinations or things like paranoia, agitation, and then other neurologic complications like stroke and seizure have all been described as part of the acute first few days presentation of COVID-19. And then what we're seeing now people have been followed out for 90 days or more post-infection, and we're seeing lingering cognitive effects and psychiatric effects, memory loss, changes in executive function. So I mentioned that earlier, the changes in kind of higher order ability to do things, depression, anxiety, insomnia. And for some people who particularly had traumatic experiences with COVID-19, post-traumatic stress disorder or PTSD has been described as well. So, we don't know yet, like 6 months out, a year out, what this is going to look like, but there's concern that there'll be lingering neurologic and psychiatric side effects from COVID-19. Now, why could that be? So here's a graphic that sort of describes what are the different ways in which COVID could affect the brain. So first of all, it's possible that COVID gets into the brain, and there's pretty good evidence of that. So we have this wonderful thing called the blood-brain barrier, which prevents bad things from getting into our brain, but it's permeable. And there are these little proteins that actually help things get across. So unfortunately, this virus is very canny, and it has hijacked one of these proteins in our blood-brain barrier, and that protein will actually transport the virus right into the brain. And so a direct infection of the brain could be part of the reason why COVID-19 has these effects. Some people get stroke. So that's that second middle one on the top, cerebrovascular ischemia. That just means stroke. So that could cause brain damage. There's inflammation. So part of what's so awful about the disease and what gets people so sick is the body mounts this overwhelming inflammatory response, which is great. I mean, that's what you want to do. except unless there's too much of it. And so some people may have negative effects from this inflammatory response, and that's systemically, meaning outside the brain. But when there's systemic inflammation, there's often brain inflammation as well. You can get respiratory failure, that's ARDS, acute respiratory distress syndrome. The ventilation itself, if you've had to be ventilated, could be bad for the brain. You can have other organs affected. And of course, there are many medications that are used as well that could have some negative effects, including steroids. Hydroxychloroquine doesn't work for COVID, and it has psychiatric side effects. So for patients who have had hydroxychloroquine, they may experience some of those side effects. So, we don't really know why, but here are a variety of reasons that could explain the link between COVID and brain disorders. Okay, so what do we know specifically about people with dementia? So older adults have the highest mortality rate of any group exposed to COVID-19 or who contract COVID-19. And then if you look further at people with dementia, they have even higher rates. So in the best study I could find of this, they looked at 3 different studies. I think it was like 2,000 or 3,000 people altogether who had COVID-19, and compared older adults with dementia and without dementia. So those with dementia, about 13% or about 1 out of 7 died, which is really staggering. And those without dementia, 9% died. So that's pretty staggering too. We don't quite know where things are going to end up yet exactly with what the fatality rate is for COVID-19 overall, but clearly for older adults and older adults with dementia, it's really, really high, and certainly much higher than something like influenza. Delirium is really, I should say, but don't poo-poo influenza. Get your flu shot. Influenza is bad too. It also kills older people. So I don't mean to dismiss influenza. Definitely get your flu shot if you haven't gotten it. Delirium, very common, and it may be the presenting symptom for many people who have dementia and COVID-19. And then interestingly, there is some evidence that older adults COVID-19 may actually sort of bring about the diagnosis of dementia. Now, did that person have dementia already and we didn't recognize it, or they had some risk for it and then the COVID tipped them over the edge? We don't quite know. But in this one study, within 90 days, 1.6% of people over 65 were diagnosed with dementia, which is staggering. I mean, that's a gigantic number of people in just 3 months' time to be diagnosed with dementia. Now, what about the quarantine or isolation itself? So that's been a big concern. We've been doing that out of necessity to save people's lives. But we also know that isolation is really bad for cognitive health and for emotional health for anybody, let alone someone with a brain disorder like dementia. So in the studies we have so far about this, the effects of people on quarantine or isolation who do not have COVID-19, who have dementia, so they're more socially isolated, of course, less cognitive stimulation, change in routine, less exercise, so 33% reduction in exercise in this one study, worse diet, including less adherence to a Mediterranean diet, and weight gain, interestingly. So about a third of people reporting weight gain, people with dementia who are in quarantine who did not have COVID-19. And we're also seeing increases in behavioral and psychological symptoms of dementia. So new symptoms like irritability and sleep problems, and then worsening symptoms in about half of people with dementia, including irritability, apathy, agitation, and anxiety. So the isolation itself is unfortunately also having some negative effects on people with dementia. What about caregivers? So not surprisingly, caregivers are feeling the stress themselves. So about half, in this one study, about half reported anxiety, a third reported feeling helpless, a quarter reported feeling irritable, and all that is more so if their loved ones are having behavioral and psychological symptoms of dementia, and also more so if they themselves are worried about getting COVID-19 or dying, or conversely, the opposite, if they're in denial about the seriousness of the pandemic. So neither strategy is a good one, being overly sort of terrified of the disease and paralyzed with anxiety on the one hand, or denying the disease is a problem. it turns out, denying facts is not a good way, not a good strategy, not a good way to live life. And so in both of those cases, caregivers found themselves in under greater stress. And then tended to feel more irritable and also kind of hyper aroused. So, not sleeping well, quick to temper, restless, that sort of thing is some of what the caregivers are experiencing. Okay, these are results from a survey that we conducted at the Alzheimer's Institute earlier this year. Jack Hunt, who is I should say Dr. Hunt, he now has his doctorate. He is a medical student. He'll be graduating medical school this spring. He's also worked in the lab of Dr. Benlin, who you'll be hearing from next. He developed a survey of dementia care specialists across Wisconsin and other members of the Wisconsin Dementia Resource Network about services, impact on services of the pandemic. And so we surveyed 128 people across the state earlier this year. And basically, I've got listed here what's less available. So not surprisingly, in-home visits, senior centers, adult day programs. I won't go through the whole list, but a range of things that people with dementia and their caregivers rely on are either not available or less available. In some cases, they've been replaced by other things like virtual memory cafes or drive-through bingo or things like that. But many of the traditional services, not surprisingly, are less available or not available. And then there are not a lot of barriers to care as well. Access to technology, compassion fatigue or caregiver burnout, changes to supports for the caregivers themselves. The caregivers may have other family obligations to tend to as well. People have lost their jobs, of course. The economy is not in great shape as a result of COVID-19. So there have been financial challenges and then also transportation challenges. I will say when we presented these results to dementia care specialists, we in turn heard lots of great ways that people were trying to solve these problems. I mentioned the drive-in bingo, virtual memory cafes. There's another county that is using some grant funding to buy Alexa devices for people with dementia who are shut in. So some really creative solutions out there to these problems. We should anticipate that we're going to see more cases of elder abuse. It's been hard to find some hard numbers. I found a number of articles that said there's more elder abuse, but when you actually try to pin down, well, what are the actual numbers? I couldn't find those anywhere. It's probably a little too early to tell yet, but I think there, we should fully anticipate there will be more elder abuse reported as a result of the pandemic. We know that people who are isolated are at greater risk of elder abuse, and isolation is, again, sort of what we're doing, a necessity of fighting the pandemic. There's financial stress. That's another risk factor for elder abuse. There are fewer services available. That's another risk factor for elder abuse. Caregivers are under greater stress. That's another risk factor for elder abuse. And then finally, people with dementia and memory loss are also at risk of elder abuse. So I don't have great numbers for you here yet, but I would anticipate that we're going to be hearing more about this. And of course, if you are aware of elder abuse, if you're in Wisconsin, each county has their adult protective services. If you're outside of Wisconsin, if you Google elder care locator, you'll get to a website that'll find, at least in the United States, what are your local services to report elder abuse to. And I should note in Wisconsin, half of elder abuse cases are self-neglect. And so I would anticipate we would see a lot more of that reported over time as well. Fraud is on the rise. So older adults are a high risk group for scams. And so there's been a 77% increase in reported fraud cases across the board, not just older adults, but everybody since the beginning of the pandemic. And fraud experts anticipate that over time, there'll be a 92% increase. In other words, about a doubling of the reports of fraud. And the DOJ, Department of Justice, actually has a nice website about this that sort of lists some of the most common coronavirus-related scams, like antibody testing fraud schemes, healthcare fraud schemes of testing and treatment through email, phone calls, or in person. and then unsolicited phone calls and emails from the IRS and Treasury employees. So those are all scams. Don't fall for them, and encourage your loved ones and people you care for to not to be very, very skeptical of any one of these sorts of messages, because they're likely scams. So unfortunately, the pandemic has brought out some of the best in people and some of the worst in people, and some of the some of the worst characters out there are fraudsters who will try to take advantage of the pandemic. Okay, so let me close with just some public health messaging. So wear a mask. It's really simple. The mask protects you, it protects other folks. It is the right thing to do. There's evidence behind it. It's the moral thing to do. Wear a mask. There's just really no way around that. And in addition, whatever your sort of local area is telling you about other precautions, follow those. Whether it's certainly physical distancing, avoiding indoor spaces, limiting your gatherings in general, and specifically, we'll get to Thanksgiving in a moment, just follow those things. Those are all, until we have a vaccine in place, which is going to be some time yet, that is widely available. These public health measures are the things that are going to save each other's lives. So do the right thing, wear a mask. And Thanksgiving, it's next Thursday. Celebrate it with the people in your home and nobody else. You can invite other people by Zoom or phone call or whatever, but keep it to the people in your household. We're all scared to death. I mean, the numbers have just been off the charts everywhere, but especially in Wisconsin. What is it going to look like 2 weeks after Thanksgiving? We're already at capacity in terms of hospital beds and all that kind of stuff. The worry is that a lot of people will get together over Thanksgiving, and then we'll have a massive increase in cases. So again, please help save other people's lives. You can, skip the big Thanksgiving this year so that you can have a big Thanksgiving next year with your alive and healthy loved ones. Same will go for the holidays after Thanksgiving as well. Okay, that's it for me. Sorry for the bit of sermonizing at the end there, but I have a platform, so I'm going to use it. There's my email if you want to get a hold of me. I'm very active on Twitter. I think that's how Fatu reached me, actually, to invite me to this. So thank you, Fatu, for finding me on Twitter. So that's my handle on Twitter. Feel free to reach out to me there. And thank you, and enjoy the rest of the conference.
Thank you so much, Dr. Walaszek. We did promise you that there would be a lot of education, and you've already seen that. That was really good, insightful information being shared. I just want to use that to remind us that this is the first annual Aging World Summit, Healthy Brains, Healthy Caregiving, promoting healthy aging, brain health, and amplifying caregivers' voices. Hopefully, as we listen to him, we're all thinking of ways we can be more empathetic and avoid and prevent all forms of abuse to people of all ages, especially our elderly, now more than ever. Thank you so much. Let's do together a virtual hand clap for him. Thank you so much.
Thank you for the invitation.
Thank you.